photo of beautiful Kia. We're here so we can get outside and enjoy it. And so we're going to go over some simple recommendations by the World Health Organization, the Center for Disease Control, and the American College of Sports Medicine on what our geriatric patients should be doing. In fact, these are the same for all of us. We should all be doing this simple cardio of at least 150 minutes per week. That's per week, and so your patient is in control of when she decides to break this up. So you can let her know if you want to go for an hour on Saturday, an hour on Sunday, and you're almost done for the rest of the week, this is per week, so you're in control of how that looks. Next component of physical fitness that's recommended for all Americans is strength training. Strength training is simply 2 sets of every body part twice a week. So 2 or 3 times a week, you're going to do 10 repetitions of every body part. And I don't care if that's rubber bands in the living room with your toddlers or your grandchildren, or going machine to machine to machine in the gym, or lifting dumbbells in the gym, or group exercise, or a YouTube video, or a DVD in the living room, whatever that needs to look like. 2 sets of strength training twice a week makes a big difference. Balance training 3 times a week, and flexibility training 2 times a week. Who's talking about this? Raise your hand if you're talking about this regularly. Yeah, almost none of us. So 2 people in the room are talking about this. This will decrease all causes of mortality 50%. I dare say there's not another pharmacologic intervention, nutrition intervention, I don't care how many berries you're going to eat or what fitness source you're going to use, that's going to make a difference of cutting all sources of mortality 50%. And so if there's one thing you're going to talk to your patients about that's going to make a difference in their livelihood and their mortality, this is it. This is where we're going. We're going to talk about some evidence, the risks. We're going to go over living space headquarters, go over some specific diagnoses with respect to restrictions, review the components of physical fitness, and then make some room around you because we're actually going to move a little bit in here. I can't talk about exercise and sit still for an hour. So the evidence for each of these aspects of physical fitness, starting out with strength training. If we look at over 120 trials with more than 6,000 older adults, progressive resistance training just a couple of times a week has a large effect on their function, their gait speed, and their timed up and go test. Timed up and go test, if you're not familiar with that, stand up, walk 10 feet, make a U-turn, go back and sit down again. Functional difference. This is things that they need to be able to do in order to function in their living quarters, not laying on your side, lifting your arm. This is a functional difference with functional exercises. Cardiovascular exercises, like we said, 150 minutes a week, decreases all causes of mortality, cardiovascular and mortality and cancer deaths by 50%. Sounds like a Sprint commercial, I know, but it's going to cut it in half. There's nothing else that you can do that's going to cut your risks in half. Flexibility is obviously needed for activities of daily living. She needs to be able to dorsiflex her ankle more than 90 degrees in order to take a step forward. If you imagine taking a step forward, that foot behind you needs to be able to dorsiflex 90 degrees in order to move efficiently. The only other way to get over the bottom foot is to roll the ankle in and put you at risk of falling. He needs to be able to extend that arm straight up overhead in order to put his shirt on. Without the ability to do that, he's at risk of not being able to dress himself. She needs to be able to flex the hip and the knee to more than 90 degrees in order to be able to get out of a chair. Right there for where you're sitting in the chair, sit back a little bit and put your feet out in front of you. You can't get up like that. If you can't bend at your hips 90 degrees and bend at your knees 90 degrees, you can't get out of the chair. And so flexibility training is important if she's going to be able to live by herself and sustain her ADLs. Balance training is, of course, very effective in preventing falls. And the 2 measures that we use to record this is the timed up and go test and the Berg balance test. I just want you to be familiar with these measurements. The timed up and go we already talked about, but the Berg balance, in case you're not familiar with that, it's a series of tests that a therapist or an assistant can do in your office with very simple equipment. It takes 10 minutes to do. It gives you a simple score on each of these 14 different tests. If she scores less than a 20, she's at high risk of not being able to take care of herself and high risk of falling. This is the test, and I hate wordy slides, and so I'm not going to ask you to read that, but just know that these are actually functional tests, real-life simulations. And so, for example, one of this is stand up and reach forward, because she needs to be able to do that maneuver in order to get the toothbrush off the other side of the sink or get her medications off from the back of the second shelf. So it's measuring functional capacity. These balance tests show that there's weak evidence for most balance exercises. However, functional exercises is what makes the difference. And that's what we're going to teach you today, is some simple functional exercises. Functional 3-dimensional exercises, not laying on your side, lifting your leg up in one plane, but functional 3-dimensional exercises like Tai Chi, and we're all familiar with the Tai Chi studies that show that Tai Chi is best, and it's not that there's anything special or magical about Tai Chi, it's that it's functional 3-dimensional exercises. How about fall prevention? The summary from that is that the exercises are effective, but it needs to be combined with a home assessment. And so if we look at almost 160 randomized trials of 80,000 subjects, either group or home exercises are very effective. So whether she's doing it in a gym or with a group or at home, but it needs to be combined with the home assessment. And so if it's possible to get the therapist over to the house to look at what's at risk at the house, that's most important. Cognition studies, disappointingly enough, actually show no significant difference, but looking at the studies included in this meta-analysis, I have a personal criticism with that in saying that the interventions are too weak and the measurements are too harsh. And so cognition needs to be looked at on a functional, everyday level. Do I remember where my keys are? Did I put the milk back in the refrigerator? Not a big test of name the last 15 presidents. And so does the cognition make a difference? The data says no, but I would dare to challenge that. Let's turn pages here and look at risk factors. So obviously 3 biggest risk factors for fall are being old, having fallen before, and being a female, specifically being a female living by yourself alone. Who else is at risk? Obviously, if you can't hear or you can't see or you can't see straight, you're going to be at risk for falling. What are the positions of risk? And so a few specific positions that you want your geriatric person living by herself to avoid. Prolonged standing is going to get her in trouble. That reaching forward while standing still is going to get her in trouble, like we talked about with that test. So getting the toothbrush from the other side of the sink, getting the medication from the back of the second shelf. So we'll need to set up her living quarters so that she doesn't have to do those maneuvers. And of course, transferring is going to put you at risk of a fall. Other risk factors to look at in the home: long drapes, long tablecloths, long fuzzy carpets, bad idea. Obviously, obesity, risk factor for falling, always. And so what can we do in the living headquarters? Step-in bathtubs make a big difference, actually. This maneuver here, that ability to balance on one foot while stepping into the bathtub, is something that most of y'all can't even do, much less the old people can't do. And if you can't do that, we're all at risk of turning into that little old guy who goes to step into his bathtub and falls and breaks his hip. And so important maneuver to be able to work on. What else can you do to help the living headquarters? So anti-skid rugs, short carpets we talked about, so your foot or your walker or your cane's not going to get stuck on the rug. Short rugs so that the wheels can roll across them. This is a genius intervention. Neon strips at the edge of the steps. I think anybody who has somebody clumsy in their house or a toddler or just a big family should have this. And so simple intervention there. Let's take a look at some specific diagnoses now. The American College of Sports Medicine used to have a recommendation about stress testing all of these specific diagnoses, but we don't need to stress test anymore a simple low-risk person. However, if they have any of these diagnoses here, they need a stress test before beginning a new vigorous exercise program. So if they have one of these diagnoses, heart failure, hypertension, obesity, osteoporosis, diabetes is included there actually, and they're starting something new and vigorous, then they need a stress test first. Keep in mind the recommendation is new and vigorous. I dare say most of our patients aren't starting something that's brand new and super vigorous all at the same time. Specific recommendations for heart failure patients: get them into a good cardiac rehab program where they're going to be forced to do these 30 minutes 5 times a week, and after a while it's going to become habit and they're going to see how much better they feel with that, as well as all the components of physical fitness, including flexibility, balance, and strength training. Moving on to the hypertensive patient, there is a specific restriction for the hypertensive patient not to lift more than 50% of the 1 repetition max. 1 rep max is the amount that an individual can lift with a specific maneuver 1 time. And so if I'm going to flex my elbow 1 time, I'm going to measure what's the maximum that I can lift 1 time for that. Then I'm going to set my strength training program such that I will lift 50% of that 1 rep max 10 times twice a week. Cardiovascular, of course, we still want to get that 150 minutes per week, 30 minutes per day, most days of the week. Obese individuals looking to lose weight almost never incorporate cardiovascular exercise or exercise at all into their weight loss program. In fact, only 20% of individuals looking to lose weight ever start exercising. And so that doesn't make any sense, of course. High-intensity exercises is even better than low-intensity exercises, and we're going to go over some specific recommendations for that in a few more slides. And so let's talk about specific restrictions on the osteoporotic patient. The osteoporotic patient, of course, needs to avoid any maneuver that puts pressure onto the anterior aspect of the vertebral bodies. And so here's your spine. The bodies are in front and the spinous processes are in the back. Any type of forward flexion, of course, puts pressure on the anterior aspect of these vertebral bodies. Here's the front side over here, putting her at risk for a stress fracture there, of course, a compression fracture. What else does she need to avoid? She needs to avoid excessively heavy weightlifting. Depending on her level of fitness and her level of strength, she needs to not lift more than 10 to 25 pounds. That depends on who you read. But of course, these osteoporotic patients do need to do strength training exercises, just not more than 80% of their 1 rep max. And so with respect to avoiding the forward flexion exercises, no bending, twisting as in golf, tennis, serving the tennis ball hard, following through on a tennis serve, following through on a bowling release, and some specific yoga poses involve a whole lot of forward flexion. And so it's important to avoid those specific maneuvers to protect her vertebral bodies. Both the strength training and the cardiovascular training increase bone mineral density at the hip and the spine. We only almost always talk about resistance training with respect to the osteoporotic patient. We need to include the cardiovascular training as well. What does she need to avoid? She needs to avoid maneuvers that look like this. Also, patients with low back problems or herniated lumbar discs need to avoid these forward flexion types of maneuvers because, of course, the forward flexion sends the disc out posteriorly and damages it even further. And so what are some alternatives to this? Obviously, lots of pressure on the anterior vertebral bodies here, and so she can achieve that hamstring stretch with a towel lying down flat there. I'm going to show you another way to do it on the chairs here in a few minutes. This obviously putting too much intra-abdominal pressure and pressure on the discs here. Better way to do that is lying supine, knees bent, feet flat on the floor, and from there she can march and raise one leg at a time rather than doing those straight leg raises. And so obviously these full sit-ups need to be buried, and from here she can do a crunch. And you can actually do those crunchies from where you're sitting right now. If you sit up tall in your chair, take your hand and put it behind your lumbar spine. So put it in the small of your back right there where you have a space, and crush your hand with your low back. Pull your belly button in towards your spine, crush your hand, hold, and release. Again, crush your hand, hold, and release. Crush your hand, hold, release. Now you can do your crunchies while sitting at the red light. You've got no excuse. And so you don't need to get on the floor and make a whole bunch of time in order to do your crunchies. There's a way to do it there from lifting up. So either pulling the belly button in straight towards the spine and from there progressing to crunches there. What else can these chronic back patients do? Pelvic tilt to bridge, starting out with just lifting their coccyx. And this is something you can teach them on the exam table, in the room. Curl up, lift your coccyx off the table, and relax. Curl up, lift your tailbone off the table, and relax. This will get them through at least until they can start some more vigorous physical therapy and learn how to do the full bridges. From there, this can be progressed to doing bridges with either the feet up on the balance ball or the shoulders up on the balance ball or the plyo ball. These patients can also do bird dog type exercises, lifting opposite arm and leg at a time. So first starting with the leg, progressing to opposite arm and leg. This can be done over the ball as well. Can be done from a high plank position. Lifting same arm and same leg at the same time is specifically challenging. Try that later on the beach this afternoon if you want. So we're going to move forward here and leave that alone and talk about some more specific recommendations of the different aspects of fitness, starting with cardio. If you have time to read that, you got that. Only 19 pounds per woman. She's mother, daughter, executive cook, housekeeper, teacher, chauffeur, and soccer coach. With respect to cardio, doctor, what type of exercise should I do? What's best for me? We all get that question. Whatever you enjoy most and are most likely to stick with for the rest of your life. I don't care if that's swim, bike, run, Stairmaster, step mill, elliptical, rowing machine, group exercise classes, boot camp classes, DVDs in your living room, YouTube videos in your living room. Whatever you enjoy most and are most likely to stick with for the rest of your life. And so, Betty, this week, 5 minutes every day, you're going to go walking for 5 minutes. Next week, every day, you're going to go walking for 10 minutes. And you're going to increase that until you're doing 30 minutes every day. And now we've just got a couch potato to walker program out of that. Building up to 150 minutes a week. If her goal is weight loss, the 150 minutes a week is not going to conquer that. The 150 minutes a week is for weight maintenance. And most Americans are holding on to too much weight in the first place. And so, doctor, I don't understand. I'm walking 20 minutes every day and I'm not losing weight. We all hear that all the time. For 20 minutes, you're not even exhausting your glucose supplies, much less tapping into glycogen stores, not even getting anywhere near the fat stores. And as you all know, you've seen the curve, for the first 30 minutes, you're just using your glucose. Only after that do you even begin to tap into glycogen stores, and only after that do you even begin to tap into fat stores. And so if we're going to use fat for energy, it needs to be beyond 1 hour. I'll tell my patients for at least twice a week, I want you to go for a full 90 minutes. Yes, all at once. If you're going to tap into fat stores, it needs to hurt a little bit. And that's not something that's politically correct to say. Everyone says if it hurts, you're doing it wrong. Hitting the wall is the way you use fat stores. It needs to hurt a little bit. In order to use fat stores, it needs to hurt a little bit. That's called hitting the wall. That's called bonking. That's called going beyond your comfort zone. So 1 or 2 sessions a week of 90 minutes. Any of the exercises I rattled off can be made more vigorous by simply getting the arms up overhead. Anything with the arms up overhead is going to get the heart rate up, and so they can lift the arms up forward, and your elderly person can do this in the chair. They can lift them up to the side while they're marching in their chair. They can do a push type of motion, and they can do a pull type of motion from there. So anything can be made more vigorous simply by using the arms. Let's switch gears and talk about resistance training. It's just as important to resist chocolates, pretzels, fried food, beers, and pizzas. With respect to resistance training, most older folks have a fear of that. They're going to get themselves hurt from doing something in the wrong position. You're wearing sweats over there. Can you come up and help me out here if you don't mind? And so people worry about and are afraid of hurting themselves with resistance training or strength training. And so correct posture is the way to avoid getting injured there. Can you have a seat over here if you don't mind? Facing me? Yes, very simple. Wonderful. Thank you. Thank you. And so simple maneuver that I really do teach in my office while auscultating a heart or getting ready to do a neck exam or a shoulder exam. Right from here, is it Joan? Mm-hmm. Joan, if you would, I want you to pull this shoulder blade towards this hip. And now pull this shoulder blade towards this hip. So it's not just back, it's down and back. So you're pulling it towards the opposite hip. And now keeping this part of your chin parallel to the floor, I want you to get your shoulders behind your ears. There you go, and relax, breathe. So the shoulders are back, chest is lifted. And so simple way to teach the posture. You can teach them this posture in the office and say, this is the posture you're going to use while doing your strength training exercises. Do you mind hanging out in the front? I'm going to use you for a few more things in a little bit. Thank you. So simple posture there. Or you can just put your keyboard up over your head. How about resistance training? Like we said, 2 sets of resistance training twice a week. And I don't care if that's rubber bands in your living room. 2 sets of strength training 2 times a week. 2 simple exercises I want you to be comfortable teaching in your exercise in your office is number 1 is a push-up against the stairs or against your exam table. So everyone's got an exam table in front of them. You can actually teach this in the room. Put your hands on the exam table. From here, you can get your patients doing a push-up. They can do that against their stairs at home. Once they're able to do 12 of these against any given stair, they can move down 1 step in their house. And they can progress to doing fancy things. Not like that. And so you can do this on the wall, you can do this on your bed, and so somebody who barely gets out of bed can even get up and do a few of these out of her bed. They can do it out of the park bench, they can do it on the stairs at home. Another simple exercise that you can teach in your office, and I'll teach this to the real elderly folks who don't get up and move enough, but maybe just moving from the sofa to the kitchen to the commode all day long. And I'll challenge them, scoot your chair back where you're sitting so you can get out of your chair. Every time you get out of your chair, I want you to get out of your chair 10 times. And when you get good, I want you to do it without using your hands. When you get real good, I want you to do it with your arms up overhead. And so every time you get out of your chair, arms up overhead. Come on, 3 times. Get out of your chair 3 times. Every time you go back to sit down again in your sofa or back at the kitchen, you're going to get up 10 times. Functional exercise. It's going to help with the transfers, help with her ability to get out of the chair, strengthening everything from the waist down. If you do it with your arms up overhead, you're strengthening everything from the shoulders down. Let's switch gears and talk about some balance exercises. And so we're going to get back to a standing position here, and we're going to actually do some balance exercises together. And so you guys are going to stand up, if you would please, and stand next to your chair. And we're going to start with next to your chair, if you don't mind. Actually, I'm going to have the light on me too much. Can you switch that one over, and I'll switch this one over too, so I'm not being blinded here. Next to your chair, you're going to tandem stance with a wide stance. And so 1 foot in front of the other, about 1 foot in front of the other. Put your weight equal onto both feet, and now close your eyes. From that tandem stance, yeah, that's not going to work either. Let's switch these chairs over.
That's okay.
Can you put that one over there if you don't mind? Once your elderly patient is able to tandem stance, either next to the chair or in the doorway holding on, they're going to progress to a one-leg stance. And so from there, lift up one leg and single leg stance. See if you can do that with your arms down at your side or your arms up overhead. From there, you're going to single leg stance while lifting your arms up overhead. From there, you're going to single leg stance, lifting one arm at a time up overhead. From there, you're going to single leg stance, lifting your arms up to the side. From there, you're going to single leg stance, lifting one arm at a time. From there, you're going to single leg stance, lifting that arm out and reaching to your 3 o'clock position. And back up again. Reaching on one leg, reaching to your 3 o'clock position and back up again. Good. And now reaching to your 9 o'clock position on the table in front of you. And up again. Reaching again to 9 o'clock on the table in front of you. And up again. Good. Keep standing. Now we're going to do some more movement here. So lifting 2 arms, lifting 1 arm, alternating with a twist, any kind of upper body circles. So standing on one leg, and you're going to circle your upper body in the same direction 3 times. Now we're getting really functional here. We're talking about stepping over the tub while reaching for the shampoo at the same time. And now 3 circles the other way. Are you struggling, John? Well, we haven't even moved yet. We're still standing still. We're going to keep standing in the same place here, but we're going to do some heel raises. You can hold on if you need to for this. Good. One more time. From here, we're going to lift our toes, alternating feet. Lift your right toes and then your left toes. From here, we're going to do some standing leg raises in all 4 directions. You're going to start with lifting your non-dominant leg in front of you 3 times. Now this is a functional way of doing leg raises, so we're not lying on our side doing these leg raises. And then out to the side of you 3 times. And then back behind you 3 times. And now you're going to cross the lifting leg in front over the standing leg and adduct it to the other side. So you're lifting it this way over to the other side. And you can do any of those standing on one leg, or make it much more vigorous by taking the sofa cushion, throw the sofa cushion on the floor, and do the same exercise as standing on the sofa cushion. And now you've just added extra instability. Do it on the sofa cushion with the eyes closed is very challenging. Or you can do it on that Bosu ball that looks like a balance ball cut in half that's at the gym. Much more challenging there. We still haven't moved. We're still standing still, so we're going to go over some walking now. And we're going to walk in place on our tippy toes. And then we're going to walk in place on our heels. Then we're going to walk in place with high knees. Now you guys want to get where you can move forward a little bit, because we're going to come up on our tippy toes and walk forwards on your tippy toes. And then you're going to go backwards with a wide gait, wide steps on your tippy toes, thinking about balance there. Now walk forward with a narrow gait on your heels. So walking forward on your heels, narrow gait. Walking backwards, wide gait on your heels. More challenging. On your tippy toes, figure 8. Figure 8 on your tippy toes. Next figure 8, on your tippy toes, arms straight up in the air. Walking a figure 8, arms straight up in the air. We're going to start some side stepping now. We're going to do a simple little dance maneuver of step, together, step, together. Now you're going to step together on your tippy toes, more challenging. Good. Now we're going to pause and stand in place. Rather than a step together, we're going to step out to the side and back to the center. Same leg again. Out to the side, back to the center. Out to the side. Now rather than out to the side, same leg is going to go out in front of you. out in front of you, and back, out in front of you, and back, out in front of you. This time when you bring it back, you're going to hold your knee up and pause. Out in front of you, back and pause. Out in front of you, back and pause. Good, now to the side with a pause. Out to the side, high knee and pause. Out to the side, high knee and pause. Don't trip over your bathtub now. Now back behind you. Back behind you, straight up and pause. Back behind you, straight up and pause. You get the idea here. So we're doing multi-directional, three-dimensional, functional training of motions that actually matter on how we're going to get up the stairs, how we're going to step over into the bathtub without getting tripped up. You're going to keep standing here while I just could show the simple exercise here because we don't have stairs for everybody. But come on over here, Joan, if you would, please. And so we know how to walk upstairs. Can you try to walk up the stairs backwards? So from here, just get to the front, the top stairs and step down again. There you go. And back down. So trusting yourself to not look behind you and step down. Excellent. Let's have you face the audience, and with your left leg now step down, and with your right leg step back up again. There you go. There you go. And lift the right leg up and step up, and then step down. And now we're going to make it more complicated. Scooch back towards me if you would, please. You're going to step across your body with your left leg and pull yourself up onto the stair. There you go. Now she's using her leg abductor to pull herself back up. You're going to step down with this leg behind you and lift. Now cross your left leg over and pause at the top on your left leg. Lift up and pause, down and pause. Up and pause, cross down and pause. You get the idea? Difficult? A little bit difficult? There you go. Thank you. Let's switch gears here and talk about, so stepping over with the pause. My fitness watch is catching all those and excuses. Let's stretch. Get your hands behind your thighs, look up, and hold it there. If you're next to a wall, put your hand on the side of the wall. If not, then put it on the chair next to you. Cross one leg in front and lean towards the wall. Lean towards your chair and stretch up. If you can't do that, then just reach that opposite arm up towards the ceiling. So stretching down the entire side of the body. Tandem stance again, if you would please, behind your chair. So one foot in front of the other, about a foot in front. Toes are pointing in the same direction. So look at your feet and make sure you get your toes pointing in the same direction. Keep both heels flat on the floor, both feet flat on the floor. Now bend both knees. And you're going to gently bend both knees until you get that stretch up the back of the calf. Like we mentioned, it's important to be able to dorsiflex to 90 degrees with that back leg in order to step over your front foot. And so simple exercise to teach. How are we going to teach that hamstring stretch without getting her on the floor, hurting her low back there? I'm going to have you sit over here if you don't mind. And so you guys can stay standing so you can see what Joan is doing here. I want you to just prop that leg up on the chair and sit up real tall. Scoot your hiney all the way in the back of the chair and prop that leg up. Now, without reaching forward, I want you to sit up real tall and come forward from your belly button a little bit. So just coming forward from your belly button so you feel that stretch back in here. That's all she has to do to be able to do a hamstring stretch. She doesn't have to reach forward, get a vertebral wedge fracture. She doesn't have to strain her neck, stretching towards her ankle. Just from a sitting up position, coming forward from the belly button. For most of you, even just getting into this position and sitting up tall is enough of a hamstring stretch right there. Let's all have a seat, if you would, please. Cross over into a figure 4. So cross this one over the bottom. And then figure 4. And from there, from that figure 4 position, sit up real tall, almost an arch there. Scoot your hiney all the way in the back of the chair. You're going to gently push that knee towards the floor. Like this slide is showing that you can't see, Jen, sorry. Next stretch, I want you to grab your knee in, pull it towards your chest and pull it in there. Like we said, you need to be able to flex that knee to 90 degrees in order to be able to get out of a chair. And so this knee flexion stretch seems so easy for you. Older people really cannot frequently flex to 90 degrees. If you can't get the knee to 90 degrees, you can't step up. Last stretch for the front of the hip. You might just want to look at the slide there to see that last stretch there. So getting that leg behind you in the chair and then leaning your torso backwards till you feel the stretch in the hip flexor, so the front of the thigh. And actually, if you plantar flex the foot behind you, you can stretch out the plantar flexors of the hip of the foot as well. And so now we just did a full body stretch in just a few minutes here and a good balance and exercise and strength training workout. Thank you so much. Thank you so much. So, silly slide. We're going to talk about a simple case here, and then we're going to wrap things up and show she's an older lady who lives by herself on the farm. She's got a couple of diagnoses of well-controlled blood pressure issues and bilateral knee arthritis. She fell and she was down all day until her son came into the house and found her dehydrated, unable to ambulate, and took her to the emergency room. The emergency room rehydrated her and stabilized her and discharged her home with her son, but somehow she's got to get back to living by herself again. And so the physical therapist came and did a thorough examination, put her on a wheeled walker. At the time, her up and go test was 53 seconds. Of course, she's not able to be independent at all with that. She was assisted with her ADLS and stairs. She was unable to do all that. She had terrible strength and balance. The most she can straighten her leg out, 8 repetitions, was only 10 times, so she couldn't even extend her leg against gravity more than 15 times. And so physical therapist came 3 times a week and did progressive resistance exercises with her. They were able to work on her gait and her functional ADLs, her transfers, her daily her range of motion, and her balance, to the point where she was able to get discharged after just 2 months into her own small home with an up and go test of 23 seconds and a pronged cane. Where's